So good evening again. My name is Eirini Neofytou. I'm a senior clinical embryologist at NewLife, and today I will talk about IVF in Greece for women 38 plus, processes, costs, and outcomes. Now, let's see this diagram. So we understand that women 38 plus start pursuing IVF and they have really many questions, hopes, and we are here for them. So let's see how things work with age. We see here that in the age group 35 to 39 years old, the likelihood of getting pregnant is 52%, dropping at 36% in the age group of 40 to 44%, and this really declines to 5% from 45 years old and onwards. Now, at the same time, the likelihood of infertility rapidly increases from 15% to 32% and 69%. So we understand that fertility naturally declines with age, but medical science, especially here in Greece, offers, we could say, highly effective and personalized solutions. So let's see why choose Greece for doing IVF. First of all, we could say that Greece has one of the most liberal and regulated framework in Europe. At the same time, the upper age limit is 54 years old. So, after just getting a permission from the national authority from 50 years old and up, you can just do IVF. Now, single women or unmarried couples can have IVF with just the need of a notarial deed. We could say also that the high quality care is at competitive European prices. So we are your destination here in Greece. I can add also that we offer egg donation, either fresh or frozen. And the last is that during the last month, the National Authority of Reproduction has changed the limit of permission doing PGT-A at 38 years old. So this is good for everybody. Now let's see how things work. If you choose to do IVF with your own eggs, the first thing is to book your initial consultation free of charge. Now, you can send us your medical history, any testing you have already done, and our medical team will review them. And in the first consultation, you will get all the information you need and options. Now, at the same time, our medical team is here to tailor your stimulation treatment in order to yield the best quality and the maximum number of eggs possible. During all that time, our team, our coordination team, will help you through tests, information needed, monitoring that can be done in your own country, and these will lead to your egg retrieval under light sedation here in our facilities. So from that time onwards, we, the embryologists, take over handling your eggs and sperm, doing the fertilization using the intracytoplasmic sperm injection for better results, culture the embryos for 5 to 6 days, and depending the decision of your doctor, either do a fresh embryo transfer or freeze the embryos. It's quite simple, I would say. Now let's see something really important, the outcomes with your own eggs. So it is really important to know that in the age group of 38 to 40 years old, 59% of embryos may have chromosomal abnormalities, what we call aneuploidies. So in numbers. At that age group, 20 to 30% live birth rate per embryo transfer without PGT. What is the PGT? Is the pre-implantation genetic testing, especially for aneuploidies, which is really useful for us because it can help us find those healthy embryos in order to increase your live birth rate to 52%. Now, at the same time, in the age group of 40 to 42%, 53% of embryos may have aneuploidies. So the live birth rate is 15% per embryo transfer without PGT. But with PGT, it increases to 50%. Of course, after 42 years old, almost 80% of the embryos have aneuploidies, which means only 5% live birth rate per embryo transfer without PGT, while up to 42% with PGT. It is very important to know that after 2 or even 3 embryo transfers with PGT-A tested embryos, your success can reach up to 97% of live birth rate. So this is the first part. If you do PGT with your own eggs, now say you don't want this option and you want to move on forward to egg donation. Things are different there. The success rates are higher, 66% pregnancy rate, 45% live birth rate per embryo transfer. Here at NewLife, you can say that this is comparable with the percentages of a 32-year-old girl. So it is really high. Now, the donors are screened medically, genetically, and psychologically, and our dedicated team does the matching based on physical characteristics and blood type. Now, your options, you can choose either anonymous donation or eponymous. It means disclosed to the children after 18 years old. Now, why choose egg donation? Because we offer a wide pool of high quality, either fresh or frozen donors, depending on how much time you want to wait or not. Let's see something really important now, the packages, the available packages, and we can talk about pricing. Now, let's say you can choose IVF with your own eggs. This package is to 3,750 euros and includes consultation, coordination, monitoring, egg retrieval, gamete, fertilization, embryo culture, and the first embryo transfer. Now, if you want to choose donor eggs from NewLife, you can choose between fresh and frozen donor eggs. After that, the second choice, if you want the standard or the advanced package. What does that mean? Let's talk about fresh donor eggs standard package. This means that we guarantee at least 2 top quality blastocysts at the price of 7,350 euros, or the advanced package up to 4 top quality blastocysts at the price of 10,550 euros. Now, we could say that the difference between frozen and fresh eggs is that the waiting time is bigger for the fresh egg donors. If you choose frozen eggs from our affiliated egg bank, again, you can choose between the standard and the advanced package, which has to do with the guarantee of the blastocyst. 2 top quality blastocysts, 8,000 euros. Advanced package with for top quality blastocysts, 11,475 euros. There's another option to choose frozen donor eggs, but from external collaborating egg bank, which means that you will choose the eggs, order them, and they will ship here. NewLife, we will handle them from the egg thawing, fertilization, and onwards, and this is at 3,140 euros. We offer a number of add-ons, we could say, like the time-lapse incubator, which means culturing your embryos and having later on the videos from their cultural development, which give us more information about their development, the quality, using the sperm sorting device for a more natural separation of the sperm and handling for use in the ICSI. You can do any test for endometrial receptivity, choose the PGT-A, depending if you have any other gene screen that you need, PGT-M, this is a different service, or the embryo glue at the embryo transfer. Now, please note that the costs for embryo cryopreservation and storage are not included. Of course, medication, flights, and monitoring at your country. Now, the NewLife difference is our team. Here, our happy embryologists that are here for you and handle your embryos. The personalized protocols according to your needs, advanced technology in the lab, time-lapse incubator, the RFID system, the electronic matching, superior experience. Everybody is here for you. And of course, our international patient coordinators that help you step by step until your success. Now I have here some frequently asked questions. I could say that one question would be how many embryos can be transferred here in Greece. So this depends on the age. I can focus on the fact that if we do PGT, of course, we transfer one embryo, single embryo transfer. But if you are doing embryo transfer with your own eggs, the law can allow you up to 4 embryos. Of course, if we have good quality blastocysts, this is something that it is under discussion. You don't need waiting time. This has to do with your availability and depending on if you choose your own eggs or the egg donation program. So we can start as soon as you're ready. Now, this change that has been in the PGT-A, it is not mandatory that you do the PGT-A, but you are allowed to do it after special permission, but it is also recommended after the age of 38 plus. What preliminary medical tests are required before starting? We could say your hormonal profile, AMH is really important for your eggs, for us to see how many the reserve that you have. Of course, infectious disease screening, that it is mandatory for everybody here in the clinic. And maybe a general healthy checkup, so blood count, and maybe you need to or maybe you have already done some kind of exams that you have available and you can give them to the doctor for reviewing. Okay, now let's see some about the questions. So I would say that Judy has a question. How many eggs can be transferred to Greece, and what is your age limit? So I would say that depends on the age limit. So we can start from different age groups. 35 years old and up, you are allowed to transfer one or two embryos from your own eggs. 35 till 40, but under 40, you're allowed to transfer up to two embryos. At 40 years old, you're allowed up to three embryos, and over 40 years old, you can transfer up to four embryos. But if the embryos are derived from donor eggs, you can only transfer up to two embryos. Okay, hello, Christina. Um, let's say I will read you the question. Christina is 38 years old. So she has a low MA and Hashimoto. Empty eggs. So this is there. We could say there are a number of explanations. First of all, low AMH, which means the reserve of both sides, but sometimes it has to do with the batch of eggs, which means that each month it's different. So, for example, if your egg retrieval was done in a certain month and the eggs were empty, this doesn't necessarily mean that if she repeats the IVF a few months later, the result will be the same. It can happen, of course. So this is why sometimes the first IVF is really diagnostic for us to see how things are. Um, Now, maybe I would suggest to repeat the process to see if this happens again, and then maybe proceed to egg donation. Well, yes, of course, we offer, we offer psychological consultations at the clinic. It is upon request, so we can book you an appointment with our psychologist. And of course, I would say that our coordinators are always by your side and as your personal psychologist. Now, Judy has another question. What is the age limit for a woman? Okay, so just give me a second. The age limit for a woman, the age limit for doing IVF in Greece is 54 years old. Now, depending on of your age, you have to choose. And if you have eggs, you either proceed with your own eggs or with egg donation. Now, when I was talking about doing three embryo transfers, I meant that we have, for example, three employed embryos tested, PGT-A tested. So at that point, the success rate can be 97%. I hope I understood correctly your question. Now, okay, so Christina gave me the specification that she had four empty follicles. Yes, I understand this means that there were no eggs inside. Again, this can be caused because we have like an indication from the AMH. This can either be repeated, but maybe not if we have a better batch of oocytes, because each month our ovaries produce more oocytes, different oocytes, genetically different oocytes. Now, hello, Gemma. Now she wants to know at what follicle age would trigger a woman age 44 with her own eggs. Usually this has to do with the stimulation protocol and the way the follicle or follicles are developing, either at 20 millimeters, but this has to do with how each woman responds to the stimulation. Because if we see that with the days of the stimulation, the follicles progress rapidly, we have to save them, triggering them, and then doing the egg retrieval. Okay, hello, Gemma. Gemma has a question. How often we are unable to retrieve eggs from the follicles of women over 43? Look, this is very personalized because each woman is different. We either have women that can have up to 10 oocytes. This doesn't mean genetically oocytes, but there are other women that have 1, 2, or none oocytes. So she says that when she had two great-looking follicles, the doctor couldn't retrieve the egg. Usually, our procedure in the theater is that we flash the eggs. So we try the better we can in order to take them. The second part is to see if they are mature, and of course, if we do PGT to see the chromosomal status of the embryos. Judy has another question. I'm not sure if I have understood correctly, because if you are 58, you cannot do IVF in Greece. Now, if you're 48, yes, or up to 54, you are allowed to do IVF here in Greece. But at this age, we need to follow a really individualized protocol, because first we have to balance things. Most women at that age do not have their own oocytes available, or if they have, the probability of them being healthy is really, really low, below 5%. So we would suggest egg donation for you, and just a single embryo transfer so that we can be safe, and of course all the necessary testing that the doctors will ask. So Gemma wants to know how to avoid the situation when the egg is stuck in the follicle. So what we do at that point is that we do flash, which means that the doctor, when having the needle in the follicle, with the help of the midwife, gives flask a special liquid designed to be compatible with the ovaries and the follicles. The follicles are being flashed, which means with pressure, we give this fluid in order to help them unstuck from the wall of the follicle and then to be retrieved. Okay, so Gemma has another question about progesterone blood test after egg retrieval. Usually, we could say that before egg retrieval, we can check your estradiol, but after egg retrieval, there is no need because the doctors would have already seen that the follicles are empty because you ovulated, because the follicles look empty, they have collapsed, or when trying to suction the from the follicle, the oocyte is not there. So there's no need on doing a progesterone blood test. Oh, we didn't lose any more questions. So before egg retrieval, yes, because we can check the levels of your estradiol. And usually, what we do, if we have a woman with her own eggs and we are monitoring a single egg, then we first do an ultrasound before entering the theater, because there is no need to do the oocyte pickup if you have ovulated. Hello, Gabriela. Gabriela asks what is recommended for a woman at 44 years old and a low MH. Can I try with my own eggs? We really need to do an ultrasound when you have your period in order to see if we see any follicles, the antral follicles, the AFC count, and if you have one or two, depending on what the doctor will see, yes, you can start. It is low, the AMH is low, but you can try if we see that some follicles are there. Of course, we would definitely suggest the PGT-A in your case for aneuploidies. Anna wants to ask something else for patients who do not achieve the pregnancy on the first cycle. What second step strategies do you typically recommend? So let's say that we have to review this case really well, because we have to see, was it your cycle using your own eggs without PGT-A, which means that we need to do more embryo transfer in order to reach the percentage of the success pregnancy. If the embryos were PGT-A tested, because this could be just a matter of not implantation of the embryo with your endometrium, we could suggest the use of embryo glue And of course, the endometrial receptivity tests available. The doctor reviews your ultrasounds because you may need any hysteroscopy if any polyp is there, and it may need to be removed. But this is something the doctor has to see depending on your case. So Gabriella gave me the information that she had 4 to 5, I understand, follicles on a certain month with the FSH here and the number of the hormone. Look, if you have in 4 to 5 follicles in the start of your period, this is a number that you can use to start. Yes, there are months that some women see one or neither follicles in each ovary, so then there is no need to start and wait for another month. Maybe it will be better. Of course, always we need to have in mind that if we know that we have a low AMH, we may see a decline in the presence of follicles available each month. So sometimes we say that we have to do a lot of thinking because we may need to put a certain, limit to ourselves. How much should I be trying with my own eggs? When to stop? Am I ready to proceed to egg donation? These are always the thoughts that have been done internally because everybody is different. Sometimes I say that you can't continue trying unless you reach your limit of tolerance, psychologically, emotionally, economically, and then maybe move on to the next step. Now just I've seen that Gemma had another question that I didn't see previously. So she asked that if the LH is low on trigger day, can it quickly rise on the day before egg retrieval? Usually when triggering, we avoid the peak of the LH in order to preserve the ovulation and cause it at the time that we need. So when doing the triggering drug, we need to do the egg collection 36 hours later. I don't know if you have any more questions. I will be happy to answer. Of course, for any questions that need better review of your case, you can always contact us by email. The email address is contact@newlife-ivf.gr. Judy has another question about the sperm sample. This is a really important question. So let's say the difference between men and women now, they we would say they are more lucky than us. So because the spermatogenesis happens every 60 to 70 days and the sperm is renewed, men usually have available more spermatozoa than our eggs. So of course we want to check the sperm sample. Usually you just provide us a sperm sample. We count and we give you the concentration, motility, and morphology, and we advise you on, for example, it's the sperm sample that will be processed and it will give the higher result. We can suggest you the sperm sorting device if we see a lower motility and not a good number of morphologically good spermatozoa. Of course, if there are no spermatozoa available, we may need to suggest the TESE, the testicular sperm um, extraction. So depending on what we see, we advise you accordingly. The embryologists are here for you. Um, so Gemma has another question. I think this is a more medical question. Please allow me, Gemma, to suggest that our doctors may be more relevant than me to, see if there is difference between the Mariofert and the Pergoveris medication. We use both of them here, depending the stimulation protocol that each doctor will choose. So, of course, we always do mild stimulation. We have never had the OHSS syndrome, and this is always our point, mild stimulation. But at the age of 44, depending on the AFC count, the ultrasound that you will do when having your period, the doctor will decide between the Mariofert and the Pergoveris. I would not advise. Gemma is also asking if I would advise the DHEA for IVF patients. No, I wouldn't advise that. Um, Now, Gabriella has another question because she says that her husband has asthenoteratospermia. We could say that if this is a repeated through tests that have been done in different time periods. As I told before, the spermatogenesis takes place every 60 to 70 days and is completed. We would suggest two different spermograms with time intervals, we could say, of 3 or 4 months. So that to be 100% sure that it is the asthenoteratospermia. And then at that point, we could suggest some vitamins that can help the sperm improve. But also, always healthier living. This may help. Of course, in the lab, as I told you before, the processing that we do during handling the sperm samples before the injection is really important in order to use those spermatozoa that are morphologically correct, are moving progressively, and of course these are this is the yield after the processing we do in the lab. So at that point, in your case specifically, I would definitely suggest the sperm sorting device, which is a device in which we just load the spermatozoa and let them naturally swim towards a certain end from where we collect them. This has been proven through studies that have been done also here at NewLife, that the DFI is really low, and because the spermatozoa that we then use for the injection are the best in morphology, and of course those that have the quick progressive maturity. I don't know if you have more questions. I thank all of you that spend their time listening to me. I really thank all of you that uh, gave me these questions. Now, Gabriella has she said that we can have an online consultation. Yes, for sure. You can always contact us with an email at I can write here again the email address. We have dedicated teams that speak your languages. We have German speaking, Serbian speaking, and of course English speaking coordinators. So I will type you the email address. And we can always book you the free consultation video call. Now, Gemma has another question that is really, really interesting. She asks about day 3 embryos, if we have day 3 frozen embryos. Now, worldwide, the embryo culture have moved on to the blastocyst stage. This means day 5 or day 6. But depending the case, because we have to take each case individually and to see if, for example, a certain couple, woman, does not form embryos at day 5, we can freeze on day 3, or we can do the transfer on day 3. We have done that with positive results with a positive pregnancy test. Of course, day 3 embryos are really strong as the blastocysts, and they don't lose a cell, so they completely survive the whole procedure, and they are safe for embryo transfer. So depending on your case, we, the embryologist, together with the doctor, decide if it is best for you to freeze and transfer a day 3 embryo or culture until day 5 or 6. So, thank you, Michelle. You're saying that you will meet somebody from our team on Wednesday. So, in 2 days' time, we'll really be really happy to see you. Gabriela is asking if we have a Romanian team. I don't know if our Serbian speaking team can help you in your language, but we will try our best. If not, our English speaking team. We have had people from Romania here at NewLife. Thank you all for your kind words. Nice to meet you. I hope I have not missed any questions. Please excuse me. But if we don't have any more questions, I will just wish you to have a good night. And those that have the meeting with us, see you soon. Thank you for attending. I would like to thank the host for having me here. Thank you all for your time. And thanks a lot also, Judy. Oh, that's really interesting. You are from the USA. We lately we have many people from the US coming at New Life, and we're really happy to meet you all from there. So, if I remember correctly, just remember that the upper age limit is 54. Thank you. Judy is asking something else. Which country any advice except Asia? I'm not sure what you mean. For example, doing the IVF. I'm going for going for IVF. I would suggest definitely coming here to us in Greece. Flights are easy. Thessaloniki is the co-capital. Very nice place to visit as well. Uh, and of course, okay, I understand your question now. She says that she's 58, so she wants the advice for the IVF due to her age. So um, I would not suggest Asia. I think that in Cyprus, the age limit is upper than Greece. And also, I think it is North Cyprus. But you have to carefully, check about the law there. So if you don't have more questions, I can end the meeting. Someone else is typing, that's why I'm waiting still here. I don't know if it is a question or just saying good night. Just give me a second, please. I'm really sorry for having you waiting. Also, Gabriella has another question. So she wants to know, with advanced age, which are the chances for a woman doing IVF with own eggs? So as I mentioned in my second slide, after for about 45 years old, we could say that the percentage drops to 5%, or it could be even lower, because this is usually due to the aneuploidies found on the embryos. But still, if a woman has eggs um, and has the emotional, I would say, is emotionally ready to, follow this way, we can try it with your own eggs. Of course, always suggesting doing the PGT-A, because there's no need on doing embryo transfers without knowing if the embryos that we transfer are healthy or not. And one of our collaborator genetic laboratories have done a very big research in which they have shown that above 42 years old, the live birth rate is less than 5%, but with PGT-A can reach up to 42.4%. Gabriella has another question. If we can work with mitochondrial oocytes, this is a technique that is really invasive. We don't do that here at NewLife. I know there are clinics that do it. I'm not sure on the outcome. I wouldn't suggest it, because it needs really delicate moves in order to remove the mitochondria from one egg to the other. And still, you don't know if this will work, how many embryos will be then formed on day 5 or 6, and with what results. Of course, there have been already studies that show that there are pregnancies, or if I correctly remember, even children having born using this technique, but it is really invasive and I wouldn't suggest it. Of course, the embryologists need to be really experienced to do the mitochondrial change. So if you don't have more questions, I can say goodbye. So good night for me. I hope I have helped you. And in case you have more questions, please don't hesitate to contact us.